getting away from this whole idea that there's anything wrong with you in the first place. Like, yes, are we having symptoms?
Yeah.
Is our body communicating that with us? Like, if we went back in time and looked at the environment you had and the foods you were eating and the influence that was taking place on your body, would you have adapted any other way? I don't think so. Welcome to Motherhood, Aligned and Assigned, where we help guide mothers from symptoms to solutions.
We're Dr. Serena Kaufman and Dr. Veronica Schultz, nervous system specialists helping families discover the missing link in their wellness journey.
Join us as we translate complex health challenges into simple, actionable solutions for you and your children.
Because your family deserves to thrive,
not just survive. Okay, today I wanted to talk about a patient because we've had a lot of really cool stories, but this one was one that we kind of went down a rabbit hole on because it's something that we see kind of a lot in different ways, but it's all the same, like, conversation or like thread line, if you will. So I have a patient that I've been seeing since about March. She came in with just like pain everywhere. She actually was scheduled to have hip surgery during her care plan. And she had asked me, is it a good idea to still start with care? And I was like, you know what, let's make sure that your body is really well adaptable as much as we can before your surgery. So she was under care for a month. This is important for later, but I'm just going to tell you, like, she was coming in 3 times a week for a month prior to her surgery. I was seeing her during home visits once a week. So it wasn't like a rigorous care plan. We had only gotten started before she kind of needed to taper off. And she came back. First of all, her surgery went so much better than her previous surgery, which her doctors had told her that the second surgery was going to be harder on her body. It wasn't. And she came to me today saying, I went to the doctor that helps me with my asthma. She was checking my lung function, and it's higher than it's ever been in, at least, and to my knowledge, at least in the last 7 years since we've been monitoring it, and possibly my entire life. So she said her lung capacity was around 70% when she first started working with them 7 years ago. It stayed there, never got higher than that. It is now at 91%, and she's doing less exercises than she ever has before. She actually said, and I quote, "And I haven't even been doing anything." And I was like, correction. You've only been getting adjusted, and it's been helping. But then later on in that, she was doing a progress exam today. Later on in that conversation, she was like, I actually think I'm getting dizzy when I'm getting up. It's not necessarily like vertigo. I've had that before, but more so like going from sitting to standing. She said she talked to her asthma doctor about it. Her asthma doctor had said, do you potentially have POTS? So she was going to go see her medical doctor to explore that. And so I think we want to talk about it because it's like we have these patients. She comes in with pain. She has headaches, asthma. She even has a history of autism, sensory processing as a child, all of these things that just keep accumulating. And then she just keeps kind of going and getting more and more diagnoses as she goes on that are more autoimmune type of based and styled. And even though not everyone's going to have this exact journey, we see this kind of trend, if you will, showing up in many different patients. Yeah. Just based on, the journeys they've been on.
Yes. And we were talking about this, and a trend I've seen is that there's always some hot autoimmune disease that everyone's talking about. 5 years ago, it was, gosh, what was it? It just escaped me. What were we just talking about? Fibromyalgia. Right. And that was just the term. I don't hear any of my younger patients talking about fibromyalgia anymore. Has not been something that they've walked in.
It's true.
Having self-diagnosed.
When we were in school, I feel like I met 6 or 7 people who were diagnosed with it.
And fibromyalgia was just doctors were sorry, we don't really understand what's wrong with you. And it's just this blanket statement Dr. Veronica was saying for your muscle fibers hurt. And
that is literally what it makes me so irritated because fiber and fibro is your muscle fibers, and myalgia maybe just means
pain,
muscle pain.
Yeah,
pain in the muscle fibers.
So it was this thing. We don't actually know what's wrong with you, but we're just gonna give it this label. And I actually, at this PX seminar, Dr. David Fletcher quoted something from one of his mentors. He's when you label me, you negate me. And so many people are chasing labels so they can get help. They feel like if I get a label, I know what's wrong with me, and then I can go do something about it. And I get that, right? Because then there's a diagnosis code, and then there's a billing code, and then insurance says, okay, right? That's the medical route of finding a diagnosis. But fibromyalgia is sorry, we don't know why you're in pain. And we'll just...
It's end of the road.
We'll just give you a descriptive diagnosis of reiterate in a medical term what's wrong with you. or like what you're telling us is wrong with you. But I haven't heard anyone talking to me about that. The new trendy one has been POTS over the last few years. And I've had a few people come in with POTS. And then the next new one, maybe these are like speeding up with social media, is dysautonomia syndrome, which is literally what we do. Let me explain. So, no, I don't have to explain it. But all of these, like fibromyalgia has very similar things in common with what your patient has been describing. And now what people are saying that POTS is. And now we're moving away from POTS. And this is just like more broad of like, yes, I am starting to pass out when I stand up. And also I don't have great temperature regulation and my heart rate doesn't regulate very well. And so it's like POTS is more narrow where dysautonomia is a more broad term. And so I was actually doing some research while we were chatting and like, what are doctors doing? What are medical doctors doing with this dysautonomia diagnosis? Like, how do they manage that, right? Because we'll get into how we manage it. You can just like listen to the last 50 episodes. But they say, this is on the dysautonomiaproject.org. Dysautonomia is an umbrella term used to describe any disorder, I don't love that, of the autonomic nervous system. The autonomic nervous system regulates functions that are automatic in nature, such as your heart rate, your blood pressure, your digestion, perspiration, temperature regulation, pupil dilation, circulation, and respiration, among others. And I was looking at, because I have a list of clinicians, and really all of they're doing is just like helping you manage what you have. That's all. Like that's their goal. It's like, your life sucks right now. Let me help you mask those symptoms so you can continue living. That's literally all they're doing. That's the verbiage they're using is like management. And for POTS, I was looking into like what do medical doctors do for POTS? And like after considering hydration and salt intake to increase your blood volume a little more naturally, and sleep, which is an autonomic function, by the way, and adjusting your diet, compression stockings, physical activity and exercise, literally just the way you should be living your life. Like once you fix your lifestyle, then they're prescribing you with blood pressure medication, beta blockers, things to regulate your heart rate or your blood volume.
Which long term has its own can of worms.
Yeah, because that's not solving a problem, right? It's masking a symptom of the deeper rooted issue. And what's interesting, like reading through those, the autonomic nervous system, the 3 scans we do in our office all have take different readings of automatic functions of the nervous system. Like 4 different ones, really. So the heart rate variability is taking your heart rate over 3 minutes. Like how variable is it? And also your skin conductance, which is an autonomic function. And then our EMG is testing the tone of the muscles or the tension, have you. And then the thermal is testing your ability for your nervous system to regulate skin surface temperature equally throughout your whole system. And we take that because we care a lot about the autonomic functions of your nervous system. And we can see where your nervous system is in its own way, essentially, or there's something in the way of your nervous system through that neurospinal system. We can remove that so that your body can adapt and heal the way your nervous system really wants to. And then guess what happens? Your breathing comes online 20% more than it has in 7 years. Your blood pressure stops dropping when you change your level of stress, right? It's like POTS is I change my position and my body does not adapt to that new position. That's what it is. It's like you have changed something and your body is so unadaptable because of the stress in your nervous system that it can't keep up with the speed of your change. And autonomic dysfunction or dysautonomia is like all of those things happening, right? Like you can't regulate your heart rate or your body temperature or your digestion. And
and it's so cool because not only, I feel like sometimes you get a label and it's like, well, that's what I have. And so everything else just like goes with that, if that makes sense. But in the office, it's like we're monitoring like those autonomic functions like you're talking about. So today, when I could see, or when she told me that her lungs were operating better, that was great. And I could literally see on the EMG, like, she had underactivity in the area of the heart area. Like, T1 through T3 was completely almost offline for her. And so it's like, is it the fact that, because it's, POTS is posterior orthostatic?
Positional.
Something like that. Positional. Okay. So I feel like when we get the label of POTS, it's like our body just can't handle changing positions without getting, some sort of issue.
Yeah, you can't, like,
fainting, dizziness.
It's like when you lay down, you need to have a different blood pressure than when you're standing up.
Yes.
Right, and your body's like, shoot, I can't change blood pressures that fast. So no blood.
Because of the lack of communication to that area, which we literally saw on our scan. She's going to go to the medical doctor, which is fine. I never say that's a bad thing. And they're going to be like, why don't you try this to see if it helps? Like, you know what I'm saying? Like, and then there's going to be a time where that area is going to turn online and she likely won't have that issue anymore. And then she doesn't need that label anymore. Right. Like, I feel like sometimes people get a diagnosis and then they stay there forever. And it literally doesn't have to be that way. It could be this temporary communication your body is trying to tell you, like, hey, something's wrong in this area. And we spend the rest of our lives almost with this label that was a temporary thing. It was a temporary solution that your body found under a state of stress. So we take that situation that caused that stress, and I understand, like, without this care, it doesn't always go away, right? Because you don't know how to help it. But in this office, we see people fluctuate through all kinds of different things because we're working with the actual reason why they're there in the first place. Yeah. And they don't have to wear these labels for the rest of their life. And, maybe for her, stress is going to happen and she's going to start having heart stuff again. Well, we know exactly what needs to happen to get her out of that. So it's more communication than anything.
Yeah. And we see this in so many different ways. Like, on the most, like, primitive foundational level, one, we're always asking about your autonomic functions to understand how you're adapting and if you're adapting well to stress. We don't ask about symptoms and pain. We ask about, how are your bowel movements? How are your baby's bowel movements? And how is your, like, heartburn and indigestion? Like, to me, that's a digestive issue. How is your sleep? Like, can you fall asleep? Can you stay asleep? And those are the first things we see come online. People are like, whoa, it doesn't take me 45 minutes to go to the bathroom every day. Which I have someone that's like, I was like, this has been with you for...
My husband's been adjusted, but it doesn't work for everyone, apparently.
Yeah, well, there are many reasons it could take 45 minutes. If you're trying really hard for 45 minutes, we gotta chat.
That is true, yes.
But yeah, we see this, like, primitively almost in babies. It's like babies are struggling to eat, sleep, and poop. We remove the stress from the nervous system that probably happened in utero, from mom stress, and in birth, from a stressful birth. And pretty quickly, they're eating, sleeping, and pooping again, like they were designed to do. But if that baby never gets care, and we've just masked their symptoms with gripe water and waited out and they'll grow out of it and Miralax and just general sleep deprivation, they're not growing out of that, right? The subluxation is stuck there. The stress is stuck there. And they're going to grow into more developmentally appropriate ways of showing you that stress, right? It would be strange if a 45-year-old man had colic, right? He's gonna express that in different ways. And I think what we're seeing in our 20 and 30-year-old women is that they're expressing it through an entire nervous system that's not regulated. I'm not going to say it's a disorder. I just don't I don't like that word.
No, because a disorder would imply that there's, like, a series of events of things that are not working the way they're supposed to.
Right.
But it's the nervous system is doing exactly what it's supposed to. If it wasn't doing this, you'd have bigger problems.
Yeah. Like, it's trying to help you with something. It's trying to adapt, and it's stuck. So dis-ease, right? Yeah. The nervous system is not balanced or not in ease because there's noise or something in the way.
Mm-hmm. And I would even say, like, it is adapting. Mm-hmm. Maybe not in the most, like, and it might even be the most efficient way, right?
It's
like, I think about
it. Right, it's like, there's no adaptation, there's maladaptation, where it's like, and then there's good adaptation. So it's like, we tried to go in this direction, and it's not the solution.
Right. Yeah, I don't know. I'm getting away from this whole idea that there's anything wrong with you in the first place. Like, yes, are we having symptoms?
Yeah.
Is our body communicating that with us? But like, if we went back in, I always think of it like the villain arc, right? Like, if we went back in time and looked at the environment you had and the foods you were eating and the influence that was taking place on your body, would you have adapted any other way? I don't think so. Like, are we stuck in there now? Yes. And maybe that's where the maladaptation comes from. But I think the actual problem that was started had to happen the way it did in order for you to get to where you are now. Because I feel like that's a big conversation I'm having with my patients, is getting away from things like bad and good. And, you know, like it just is. Like, the nervous system didn't necessarily give you a bad outcome or a good outcome. It just is. It did what it needed to do to get you to where you are now. And then once it got stuck there, then we start to have some maladaptation, because the body was never designed to carry that much stress for that long amount of time. But I think the actual, like, I don't know. I know I've seen all kinds of terrible symptoms and illnesses where it's like, you think that this is good. And it's like, I wouldn't say it's good or bad. I would just say that is what needed to happen, or you probably wouldn't be able to take your next breath, which is all your body is designed to do, is to help you take your next breath.
Yeah. And here, that's, to build on that, it's like you have two, and this is something that's really fresh from the seminar too, that was like reiterated and solidified and really helpful for me, is that you're born and wired with a full throttle sympathetic nervous system, which is that fight or flight, keep you alive system. And
because you just sat and like cooked for 9 months.
Yeah, and that's just how we're wired, right? That's like that's just like ingrained in us, and that's always going to work. That's like our default setting. And then we have vagal tone that comes in for our parasympathetic nervous system. That is the rest, digest, grow, reproduce, all of the brake pedal functions that operate. It's not this or that. It's they regulate the sympathetic systems. So if you have poor vagal tone, it's really hard for you to slow your heart rate down, slow your respirations down, regulate hormones, digest well, right? And so what chiropractic is doing is not like taking away your sympathetic nervous system or suppressing anything, right? Like, big thing on that. It's like, we're not actively suppressing your sympathetic nervous system like drugs. We are improving your parasympathetic tone via your vagus nerve, which is like that's less of this concept of this segment is tired and exhausted, so these organs aren't going to work. Which is like, that's a thing. I've seen it in my clinic, right? That's a thing. Right. But there's also this global system that has to have good tone and vitality to regulate this like roaring sympathetic fight or flight system that's going to keep you alive and do its job when vagal tone falls off or never got to develop well in the first place.
Right. And that, folks, is what every autoimmune system, every autoimmune condition pretty much stems from.
Have a nice day.
Would you like to pray us out? Do you want me to?
You could do it.
Okay. Dear Lord, thank you so much for just the wisdom and knowledge you've given us to support the clients in the way that we do. I think the work that we get to do, the testimonies, the outcomes, the miracles that we see every single day sometimes can feel like everyday things. But it's times like this when we get to reflect on the knowledge, the science, the wisdom, and just the experience of it all, to know that you are working in these practices, you are working in these nervous systems, and we are essentially helping people fall back into the design you created in the first place. We love you, we honor you, praise you, in your name we pray. Amen.
Thank you for joining us on Motherhood, Aligned and Assigned.
We hope today's episode helped you connect the dots in your family's health journey.
Remember, this is where nervous system health meets motherhood wisdom.
Until next time, we're Dr. Veronica Schultz
and Dr. Serena Kaufman, supporting you as you nurture your family's well-being.
Because when you're aligned, everyone thrives.